Hey, Facebook friends, how are you guys? It's 3:01, time for our daily get together, hang out, if you will, on Facebook and then also on air to talk about how we are getting through this shelter in place, the Bay Area lockdown, and the coronavirus pandemic altogether. Some of you may have been watching President Trump's news conference, which is actually being held right now. But we thought we'd pose a question to you to get started today, which is kind of prompted by my own challenges this past week buying toilet paper. It's been nearly impossible. So I thought I'd throw it out there. What are the things that you're having trouble getting at the grocery store? So Facebook friends, let me run through this with you. Michelle Bergman, you said hand sanitizer. Yeah, thankfully, we do have a good supply here at the station, which I seriously use like every minute. My hands are getting a little dry, but I think it's worth it. Rub back and forth. Princess Egu, you say Lysol. That's been hard. Yep. And we also put together a little list here of some of the common responses from you folks. Hand sanitizer. Yeah, alcohol. Not sure if you mean like rubbing alcohol or drinking alcohol. I'm going to take it you mean rubbing alcohol, which I've had a hard time getting as well. I hear beer and wine are in plentiful supply. Now, toilet paper with exclamation points. Yeah, so many of you are talking about that because that is nearly impossible because people continue to, as soon as a shipment gets in, they buy huge packages in large quantities for like a month. Try to only buy what you need, all right? So your neighbors can buy some as well. Eggs, paper towels, milk, and meat are all things that you guys have had a tough time getting at the grocery store. Yeah, so let's see. Another full day of news today for you surrounding the coronavirus, from another country locking down to a local company, answering the call of Governor Gavin Newsom, right? Gavin Newsom said, hey, if you're at a company and you guys can help, you know, whether it's to make PPEs, personal protection equipment, or ventilators, or things that could help us all during this crisis, especially healthcare workers, do so. So we've got a great story for you. So a lot coming up. So thank you so much for joining us. All right, just want to make sure we're still on Facebook, folks, right? Just on Facebook. All right, I do plan on talking directly with you on Facebook Live, as we're doing now, because we're all going through this together. So I want to interact with all of you. Feel free to jump on and talk to me right now on this page, on this thread. We're monitoring it. Ask questions or just say hi if you want, right? Top fan Cece Marie says, toilet paper hard to get. Yeah, I know. Hey, Tammy Chan, thank you for watching us. Neva Wandersea, thank you so much for joining us today as well. We really enjoy having your involvement and sharing your thoughts as well. So we're streaming on YouTube as well. If you are not watching on Facebook, you can check us out on YouTube, ABC7 News app, which is free, of course, and ABC7news.com. We're also going to be on TV as well. That is our plan every day at 3 o'clock. But the benefit of streaming is you get added content, of course, during the breaks. And that's also when I get to just sit back and we can just talk. So first, let's give you some of the headlines from today. All right. We'll start worldwide. The Dow saw its biggest ever point gain in one day, up nearly 2,113 points. This comes as Congress is moving closer to passing a coronavirus package, an aid package. They've been going back and forth and still negotiating it, but you know, just the prospect of that is sending the Dow and investors happily up. The 2020 Olympics in Tokyo have officially been postponed to 2021. So they were talking about that for a while, so it's been postponed. The lockdown in Wuhan, China is expected to be lifted early next month. India's prime minister announced a complete 21-day lockdown for the entire country. That's 1.3 billion people there. And closer to home, here are some headlines. Santa Clara County now has 16 deaths related to the coronavirus. A second death has been confirmed in Alameda County. Also, a sergeant with the SFPD, 2 employees with the Santa Rosa Police Department, and a 4th deputy with Santa Clara County have all tested positive for COVID-19. So that brings more than 2,000 confirmed cases and 40 deaths related to COVID-19 to California. So those are the numbers we have right now. All right, so let's check out what some of the comments that you guys are leaving for us. Lakinda Reynolds says, okay, you're having a hard time getting baby wipes for the babies. I saw some cool videos on how to make your own using paper towels, like rolls of paper towel, and then you soak it in some sort of solution. I hope to share that with you in a few days, although I do understand paper towel is hard to get as well. So what I've got to say about that is if you don't actually need baby wipes because you don't have babies, please try to save those for the moms, the dads, and the babies, all right? Okay, we had a really good conversation with San Francisco Mayor London Breed earlier today on Midday Live. So right now I think it's a good time to share part of that with you. We also asked you if all public places should be closed. 86% of our viewers said yes. So if you're on Facebook Live, give us your opinion on that right now. Should all public places be closed? And I'll try to read some of our comments on that. So here's what the mayor said.
Well, I hope we don't need to. That's really why my message yesterday was to make it clear to people what they should and should not be doing. The fact is, you shouldn't be planning picnics and play dates and basically out and playing even basketball with other people because those are the kinds of things that will provide an opportunity for the virus to be transmitted. This is really about public health and public safety, and so we don't want to get to a point where we have to close down everything in order to get people to comply. We know that people need fresh air, they need to get out with their families that they live with is most appropriate. But when you start adding friends and you're having meetups and you're playing volleyball and you're crowding the beaches and you're not doing what we've asked you to do by social distancing from other people who are not a part of your household, you are putting lives in danger. And so as long as people work with us to follow the order, we will allow the spaces to remain open. But if we notice that it's problematic and people continue to gather at Ocean Beach or Dolores Park or Crissy Field in large numbers, we will take action.
All right, so you heard the mayor there. She said that, look, if people can't do it voluntarily, then we're going to have to close those places. So we asked you, what do you think? We got some really great responses. Pookie, Callaway, Vaughn, you tell me all public places should be closed, folks. Do not follow instructions. Folks do not follow instructions. No one is taking this seriously. And Najeli Marquez, you're telling me, yes, they should be closed. So it sounds like a lot of you support that measure. Christopher Ian Garcia, thanks for telling us you think parks, beaches, hiking trails should be closed. And again, the message from the mayor right now is, sure, use those places, but do not congregate in groups there. That is not a place for you to socialize with your friends. It is a place for you and just your immediate family to walk and get some fresh air. Okay, so thank you for telling us what you think about that question. We also asked Mayor Breed about President Trump saying he wants the country to be open and raring to go economy-wise by Easter.
My response is, why are we still listening to the president? I mean, the fact is, we here in our city, throughout states in the United States of America, we have demonstrated, sadly, that we've had to jump into action and make this work. Without federal government support. I mean, even here in San Francisco, we've had private companies go out and get masks and PPE in general to support our healthcare workers. We've had to basically be innovative and work with the private sector to try and get the resources we need in order to make sure that public health was protected. The federal government just isn't moving fast enough. I know the Speaker of the House, Nancy Pelosi, is busting her butt in Congress to try and get us the package that we need that's going to actually help workers and not necessarily corporations. But you know what? We don't have time to waste. Lives are in jeopardy. I mean, look at what happened in New York. San Francisco is at 152 cases as of today. And so we don't have time to mess around with not only helping to save lives, which should be our #1 priority, but also looking at stimulus packages and other things that we can do to help support people who we know directly are going to be struggling financially.
All right, so that's Mayor Breed talking about President Trump's response. Now, you can tell, does not think that the business, of getting about the economy back up and everything opening back up should be happening anytime soon, certainly not in the next 2 weeks. And if you follow the scientists and doctors' models, it seems like a lot of them are saying in the U.S. we may start to see the peak in 2 weeks. So if that's the case, opening everything back up and, not restricting movement anymore could certainly propel that peak even higher. So that's the point that she was trying to make. All right, I want to read some more of your comments here that you shared with us. Charlene Jewett, you tell us that you think non-essential businesses should be closed. All right, appreciate that. And then Monique Castillo-Porter, you think that all businesses should be closed except for grocery stores. There's still over 10 people at a time. All right, I have to say that, grocery stores should be open, obviously, but I have gone to a couple of stores in which I thought, oh, people are a little close. No one is observing the, 6 feet distance thing. So we all need to just be better about that. Even if we, if it means waiting till the other person is done, getting their ice cream out of the freezer before you approach, then that's what we do. Okay, so Patricia Bahada, you are asking, so is the mayor going to pay your bills? So I'm going to answer that. I don't think she can pay your personal bills and all the bills, but she did talk to us about this SF to Gov. Help me out with the website. I think our producer knows the website, but it's a fund that San Francisco has set up, and it's got $5 million in it now. It is heavily contributed to by local businesses, big companies like Salesforce. It's called give2sf.org. So give to, numerically, give2sf.org. So they've got $5 million and it's growing. Businesses are chipping in. The city's chipping in. And that fund, the idea is it's supposed to be kind of a rainy day fund with money going to San Franciscans who need that cash now. So there's that assistance. In addition to that, don't forget, they put a moratorium on evictions right now. Also, if you're late on city-related fees, penalties, or taxes, they're not coming after you right now either. So all that signals a willingness and desire by the city to not tax people financially further at a time when people are already struggling to pay their bills. So, hopefully that helps you out. I'm glad you asked the question. It's a really important one. Okay, so what do you think? Wow, Jen Miller, you think there should be martial? I assume you mean martial law. Obviously, the country is not there yet. That would be the most drastic step, most restrictive, most extreme step. And we hope that we don't have to get there. And the message we keep hearing over and over again by public health officials is that if we take the dual steps of social distancing and sheltering in place together, not just one, that would not be sufficient to save us from the point of no return. But if we do both those things, then it is possible we may not need to get to the martial law stage, and we won't overwhelm our healthcare system. All right, those are great questions. Thank you, you guys. Thank you for jumping in and joining the conversation. We're going to take a short little break, and then we'll be back with more on Facebook and on air on ABC7.
The President stood FEMA's National Response Center up, and they are in the lead for the approach to the coronavirus, which is locally executed, state managed, and federally supported. And we'll continue to surge those resources and make sure that they're available. One last word, if I may. The President reflected on the response that businesses around the country have brought to this moment. It truly is extraordinary. The President did initiate the Defense Production Act last week, but as the President has reflected many times, we will use the Defense Production Act if we need it to mandate production of critical supplies. But so far, no one has said no. And in fact, we see industries stepping up. The President mentioned Ford Motor Company working with 3M and GE Health to expand production of medical supplies. We heard that McDonald's is now offering curbside delivery to truckers who are unable to use the drive-through to pick up a Big Mac. And I spoke today, and the President spoke last week with Tim Cook of Apple, and at this moment in time, Apple went to their storehouses and is donating 9 million N95 masks to healthcare facilities all across the country and to the national stockpile. There is a level of generosity that I know is inspiring to the President, and it's truly inspiring to all of us who are working on the White House Coronavirus Task Force. The President's made it clear that he hopes, in weeks, not months,
All right, you've been watching a live news conference by President Trump and Vice President Mike Pence, giving the nation an update on the coronavirus response. And he is saying that for anyone that has left the New York City area, asking people to self-isolate, giving you a sense for how serious things are in New York. That is sort of the epicenter right now for this pandemic, at least in this country. All right, thanks for joining us for ABC7 News. As you heard, also, we want to welcome you to our 3 o'clock show, which every day we're coming to you at this time, focus on the coronavirus. We've been streaming online. Now we're on air as well. Hospitals in the state, as you heard just now, have a dire need for ventilators, right? Across the country, but here in California, too. Those ventilators help coronavirus patients breathe when they're unable to breathe effectively on their own. Italy has a shortage, and doctors have had to make life and death choices of who gets one, who gets to live. That's why Governor Newsom issued a dire call for companies to step up, and one Silicon Valley company heeded the call in a big way.
We reached out to KR, who runs Bloom Energy in the state of California, a manufacturer here in the state, well known to Californians, particularly in the green energy space. KR said, "What do you need? We're ready to go." And we said, well, why don't we test this? You produce these remarkable fuel cells that are power fuel cells. You've got all kinds of technical capacity. We have all of these old ventilators that we've been storing for years. They have to be repurposed. The manufacturer said the following: to repurpose about 200 of them is going to take a month. We challenge you to do more and do better. And so KR sent me a photo today, not making this up, of 24 specific ventilators that he got done just in a few hours. And he says, come down, certify these, inspect them. And if these things are certified and we're confident you're going to sign off, give us the rest. We're ready to go to task.
Wow. The company Governor Newsom applauded in his news conference Saturday and yesterday is Sunnyvale-based Bloom Energy. Bloom is a leader in alternative energy and normally makes fuel cell power generators. Joining us for his first local TV interview about his company's efforts here is Bloom CEO KR Sridhar. KR, how are you?
Hi, Kristen. Nice to talk to you.
Nice to talk to you. Me saying your name, let's be honest, is not the same as Governor Newsom saying your name, right? First name basis now, KR.
Yeah, absolutely. Look, I just, KR is great. And the reason you bringing this up is important is we want awareness. We want every hospital to know, as they're using their ventilators, if they have ventilators in their basement that are not working, send it to us. We want to fix it as quickly and get it back to you.
All right, your factory's open for business. That's great. Full disclosure here to our viewers. KR, you've been a friend for a long time. Do you remember over dinner when you told me about your idea of power generators in a box?
Yes.
And now your box is reality. In fact, they power leading Silicon Valley companies. You went public, and now you are stepping up to help our state in a crisis. So I could not be prouder of you, KR.
Thank you. That's so kind of you. Look,
I want you to tell me, how did it happen, though? Let's first back up. How did this partnership between you and Governor Newsom happen?
So what happened was we just got a call from the governor, and he said, look, there are hundreds of ventilators out there that are in need for refurbishment and we need to get this out quick because, like you clearly said, we don't want doctors to make that tough call of who to have the ventilators given to and who not to, give it to. That'll be a tragedy. So how do we get as many ventilators out? To go build a factory and make new ventilators where you've never done that before, create the supply chain, those are all going to take a lot of time. So being able to take these thousands of ventilators that are not fixed, fix them as quickly as possible and get it out will be the best thing to do. So when he said that, we didn't even have to blink. Kristen, I think you remember, we were trying to produce oxygen on Mars.
Yes. Yes, NASA asked you to do that, right?
Yes, because NASA asked us to do that. And, that was my past life before the company. And here we are, an opportunity to get that oxygen to people who really need to breathe. And we just said, we will go figure out how. And that's how it all got started. It was just putting your hand up and saying, I want to help.
All right, so tell me about the scope of your first batch. You did how many ventilators and how long?
Okay, so we just proactively sent one of our employees to Sacramento in a pickup truck. This was on Friday. and said, pick up 20 ventilators, bring them back, we will just test. By Saturday evening, we had them all refurbished. And we knew that this is something we can do. So we said, if this is the case, and if it is in one warehouse, there's 400 plus ventilators, how many of them are there going to be in the country? So we have a factory here in Sunnyvale, but we also have a factory in Delaware. We said, we are going to repurpose both those lines to be able to do hundreds, both for the West Coast and the East Coast.
That's great, because we're going to need that. We're going to need them.
Today, we can tell you that between the two coasts, we can do hundreds of ventilators a week and ramp that up even more if it is necessary.
So can I ask you, was it challenging converting the plant and the people, the expertise from your normal operations, making fuel cells, to refurbishing ventilators?
Look, we pride ourselves in building complex equipment that nobody else can do. This is American ingenuity, this is American creativity and skill sets. And having local manufacturing is so important. You know, today during crisis, we are seeing that we have a problem with having local supply chains. And what we are trying to do out here is we have local manufacturing. During a time of crisis, we need to step up and do what we need to do.
Okay, but you're still making your fuel cells too, right? I mean, your normal business, your normal product.
We're doing normal fuel cells because that's so important to keep the hospitals running. And that's so important to keep the different businesses going. But we are doing this with two things. Number one, we are doing our normal business. We're stepping up and doing this. But first and foremost, we're making sure the safety of our employees and everybody around us when we do this. So we're doing and. There is no or.
You know what? Until this, I didn't really realize there was a huge stockpile, if you will, of old ventilators kind of sitting in basements at you know, companies, at hospitals. And I think a lot of people weren't aware of this.
I think a lot of them were purchased during the SARS epidemic that really did not turn out to be as big as they thought, and they had prepared for it. So these were put away in basements and other places and not really, you know, put to use. And if most things like this are stored for a very long period of time, you'll have to take it out, you'll have to replace the batteries, you'll have to change the pipes, you'll have to change the plumbing, and make sure they're all in working condition before you put it out. And that's exactly what we were trying to do.
All right. And also, don't you need to put in anything specifically for COVID-19 in terms of the filters in these ventilators?
No, what these ventilators do are very simple. They are devices that supply oxygen to your lungs because you can't breathe on your own. And they also take out carbon dioxide from your bloodstream because if carbon dioxide builds, that's not good for your body. So that's what these devices do. And because the air being brought in is ambient air that's clean, you really don't have to do anything other than make these ventilators work and do their normal function.
Got it. All right. I know that, you know, there are other tech companies that have stepped up. Elon Musk and Tesla got 1,000 ventilators in from China as well. What do you want to say to other companies, other innovators, as we battle this pandemic?
During a time of crisis, it is one thing to say, let me know if you want any help. And people are too busy. They can't come out, find out who's doing what. It is you that knows what you can do. So each company should take it upon themselves to say, what is the need out there? I'm going to find out. I'm going to proactively figure out how to take those skill sets and parlay it into helping people. And we're all in this together. We all need to help out. This is time for leadership. This is time for us to, you know, unite together as one single whole and do what we need to do.
Well, KR, I know that Governor Newsom has thanked you. Not the same coming from me, but I want you to know that we are very grateful, all of us, for what you're doing right now to support our healthcare workers and our nation during this time.
Well, thank you for taking the time. And there's one thing I want to mention. We have created an 800 number and ventilators at bloomenergy.com. I would love for you to put that up on your site at some point in time. So any hospital, any doctor, any patient seeing this, if they know of ventilators that need to get refurbished, please use that as a resource and reach out to us. We have our sales and marketing team waiting as volunteers, taking this information, and we will send people out, pick those ventilators, bring it to us, refurbish it, get it back to the hospital as quickly as possible.
All right, deal. We'll put that out there. KR Sridhar, Bloom Energy, thank you so much. Take care.
Thank you.
Good
Take
to
care.
see you. All right, and we'll take a short break and be right back with more.
We are in commercial break.
All right, hey folks, we're still on Facebook, right? Hi folks, I am logging back into Facebook. Thank you for watching that and sticking around with us through that segment. Didn't you think that was super inspirational? I thought that was pretty incredible. If I can just get my Facebook up, laptop. But I wanted to thank you and see what y'all think. I hope you enjoyed that interview. I have known Sridhar for a long time, and he's a scientist and a visionary. So for his company to just kind of answer Governor Newsom's call and say, what do you need? Okay, sure, we'll convert a factory. We'll jump in and refurbish old ventilators and get them online so that our doctors and hospitals have more. I think that's pretty cool stuff. All right, folks. Hey, Mr. Producer, if you can feed me a question and tell me what some of our viewers are saying as I log in. Oh, we're getting a lot of thank yous. Okay, I'm logged in now. Thank you. Thank you, KR. You are a blessing. Ali Shah's message. Milena Alamo Walker saying thank you. Bob Matson saying awesome of him. I could not agree with you more. I think that is totally awesome that a company sets aside their main product, which of course they're still making, and but is focusing most of their attention now on refurbishing ventilators, something that we so need. So yeah, that's pretty cool. Faye Sahai, thank you Bloom Energy and KR for building and repurposing needed ventilators, equipment for the virus. There was a lot I didn't know before this interview. I didn't know that we had so many that were just sitting there that needed refurbishing, and that, you know, a company such as his could just kind of jump in and start doing it. I didn't know that. So that's partly why I love my job, because there's a lot that I don't know, but I'm always talking to people who know cool stuff, so I'm learning along with you. We're now able to bring you even more content now that we have this new platform at 3 o'clock every day. That means we get more from our special correspondent, Dr. Alok Patel, as well. And he's part of our coronavirus team of experts, and every day he's going to talk directly to you in a segment we're calling Doctor's Note. Today, Dr. Patel is talking about social distancing after Governor Newsom's direct message to young people to take this seriously.
I'm Dr. Alok Patel, and this is today's COVID-19 Doctor's Note. Now, regardless of what you call it, sheltering in place, social distancing, here's why staying away from people right now can save lives. Nearly 100 million Americans from Michigan to Illinois to New York to California are under stay-at-home orders and are asked not to leave their houses except for essential businesses. Here's why this is crucial. The virus spreads from person to person quickly in an almost exponential fashion. We break that chain, we curb the spread of disease. Now, the scary but real fact is you can be contagious even if you have no symptoms. The majority of the virus is spread by people who don't even know they're infected. So to anyone who's young and healthy and thinks, I'm good, I can go out and party. No, please, party by staying home and watching Netflix or Skyping with your friends. Even in this dystopian reality, we can still check in on one another and unify. By social distancing, you're not only protecting yourself, you're protecting your community, those at most risk, and you're gonna keep our healthcare system from hitting a max critical capacity. That's an empowering responsibility we can all get behind. So do your part and shelter in place.
Try distance socializing. All right, thank you so much for joining us on this new experimental interactive show. We'll be here every day at 3 o'clock on air, on live stream, Facebook, YouTube, ABC7news.com, and our app. Now stick around for World News Tonight. Take care.